Okay, welcome to Deuk Spine Institute Surgery Center VR. We are performing a Deuk plasma rhizotomy cervical spine, and this patient has cervical facet joint pain on both sides from C5 to T1. Severe pain with rotation. Shot. You can see on the x-ray. So let's see, I'm going to count. Let's count so our audience can count with us. So go down to T1. There's the pedicle of T1. Then up 7, 6, 5. So we're doing 5, 6, 6, 7, 7, 1. To do 5, you have to go up to 4 and get the medial branches of 4. Shot, which we're going to get just to be sure we cover every source of pain for his facet. Everything okay, Dr. B? Yeah. Now, to do this, I have to put my plasma probe shot onto the lateral mass shot, and I want to be just hovering over the lateral border of the lateral mass. And then I'm going to turn it on and work my way down. And you want to be on the lateral border. That's where the medial branch of the dorsal ramus climbs up and over that waist. Show us the waist. That's right. See the waist there of the lateral mass? We call it the waist, like a waist around where your belt is. It's like a waist. Shot? Not a W-A-S-T-E, but a W-A-I-S-T. So we're treating this medial branch here. Now, I will say our patient Shot has traveled to us from Australia. I think he's from Melbourne. Is it Melbourne or Sydney? Melbourne, Australia. And he's come to Melbourne, Florida. So when he found out the Deuk Spine Institute was in Melbourne, he got excited. And then he found out, well, actually, we're in Melbourne, Florida. And then he said, well, I guess I'll be traveling 24 hours to get to Deuk Spine. Now, he can't get any of this treatment in Melbourne, Australia, because it doesn't exist in Melbourne, Australia, yet. Now, someday it may, but not today. Any questions from our audience?
No current questions.
Unfortunately, we don't have a video animation on this surgery yet to show you. I can feel the arthritis. It's horrible. It's really, really bad. Shot. All right. 7, 6, 5. We are at 5. Yes, sir. Yeah, I agree. And I'm working my way down. The next that we're going to get is C6 on the left. Shot. Making my way down there. I'm going to just get this C6 done, and then I'm going to basically move to C7 with a new incision. Shot. All right, looking good. Looking very good. What do you think, Jordan? I think it looks damn good. Yeah, I think it looks... All right. That's basically 5, 6, and we're going to do 7T1 next. Okay, so we're going to place our second incision a little bit lower. Shot. That's perfect. Num num. All right, if you have questions, feel free to answer, but you are watching a Deuk plasma rhizotomy cervical facets. We're going to go bilateral C5, 6, 6, 7, 7T1. That's where his facet joint pain is. And again, he's traveled from Australia to Florida, from Melbourne, Australia to Melbourne, Florida to have the Deuk plasma rhizotomy and the Deuk laser disc repair. Now, to do the Deuk plasma rhizotomy cervical, he needs to be on his belly, which he is. He's asleep completely with general endotracheal anesthesia, because after we're done here, we're going to flip him over and we're going to move on to phase 2, which will be the DLDR cervical. DLDR stands for Deuk laser disc repair. Shot. All right, looking good. Feels like I'm slipping. Let's just see. Shot. I'm right at the waist. Wouldn't you agree, Jordan? You don't want to slip off the side because then you got your vertebral artery down there shot and it would be bad. So you want to make sure you're staying right on the bone. And you want to be on that lateral margin of the lateral mass of the cervical spine, which is right where we are. And I'm burning without removing my tip. We're burning an entire area from the facet joint to the facet joint. And that's, look at that positioning. That's absolutely perfect, right where that tip is. That's where the medial branch of the dorsal ramus comes out and wraps around. All right, we got one more to go. That's going to be our T1 shot. Need to be a little bit lower. Shot. It's not bad. Shot. I'm pretty happy with that. That's one side down. And now we're going to move to the right. That left side went well. Again, you're watching a rhizotomy procedure. Now, rhizotomies have been around for a long time. Rhizotomy means to destroy a root. And a rhizome is a root. Rhizotomy means to cut or surgically treat the root and cut it. However, the rhizotomies that we've been doing for many years for pain management are done with what's called radiofrequency ablation, RFA. The problem with RFA is that it doesn't last, and many times it doesn't even work. And the reason for that is quite simple. RFA does not deliver enough energy. All right, so there's 1, 7, 6, 5. I want to be up a little bit higher at 4. So the problem is, shot, the RFA doesn't deliver enough energy to actually kill the pain nerve properly, to perform an actual rhizotomy. So even though the doctor says we're doing a rhizotomy, they're not actually doing a rhizotomy. They are wanting to do a rhizotomy, but they don't actually cut through the pain nerve. So we developed a new technology here at Deuk Spine. We took an old technology and applied it here. And as a result, we have been able to do permanent rhizotomies that actually work. So we've been doing these now for about a year, maybe a little longer, and just by themselves. Now I've been using this device for 25 years. And it dawned on me one day, hey, this device could be our answer to getting a permanent rhizotomy effect instead of the RFA. And sure enough, we started to use it, and the results were amazing. Patient's pain was going away completely. Shot. I've just got to get it right on that bone there. See the waist?
Yes, we do.
Any questions from our audience?
No current questions.
Shot? All right, once again, you are watching a Deuk plasma rhizotomy cervical. Shot. Shot.
We have a question.
Sure.
This comes from Kit on YouTube.
Is his head rotated? It is, right? I need him straight up and down because it's moving his spine away from the side I'm working on. Shot? 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 All right. Thank you for that. Yeah. Shot? Do you feel me touching him? I feel it. Give me a second, Henry or Sanjay. I just want to make sure I'm in the right spot here.
Copy
Shot?
that.
And then I'll take the question from Kit. Do you have another tip?
Can we have another tip, please? Another body tip, please? Thank you.
All right, we'll take the question while we're waiting.
They just Kit asked if we can show the bird eye view when doing the DPR, and I'm waiting for the
eye view.
Yeah, the eye in the sky. And they also said I'm waiting for the appointment. Can't wait to go see you.
Oh, thank you. Yeah, I appreciate that. The bird's eye view. Give us a second.
We're on it. It's all good.
That would require we have to move out of position, but we'll show you. We'll show you what we're doing with the area we worked on when we're done. Looks like his head is kind of off to the left. Like, look at his X-ray there. You see how it's kind of like going off? I don't know. Maybe you can move the donut or face thing to the right, to your left a little. His right, just a little bit. I don't want to do anything with the tube. All right. Yeah, it's just whatever you can do. It's fine. It's just the best you can do would be great. There, I feel it now. Shot. It's too medial. Shot. That's better. Better. Yeah, we can't really move the fluoro out because we need it. I'm keep checking my position. Shot? It wouldn't be very responsible of me to do that. So I need to keep it here for now. Shot? All right, so far so good. We're burning all these pain nerves laterally. Remember, these are called the medial branch of the dorsal ramus. Shot. Shot. So before I do a burn, I'm going to plant that tip where I want it. And I'm going to plant it on the lateral mass right there. That's like the perfect spot. Okay? And then I'm going to activate it, and I'm going to create my lesion, which is, of course, a lesion of the medial branch of the dorsal ramus. This eliminates facet joint pain. This patient has facet joint pain in his neck. How do you know you have facet joint pain? The pain is off to the side, and it is worse with rotation. When you turn your head, look over your shoulder as far as you can go. If that creates pain, that means you have facet joint pain. Don't take too much. Shot. All right, we're on our last one at this point. Let's see where we are. Shot. All right, looking pretty good. Go ahead. We're going to put some more numbing medicine in there. Numbing medicine is there because we're creating pain when we do these burns. All right, we're burning, and that's going to hurt. Even though the patient's asleep, completely under anesthesia. The pain fibers are activated and they send signals to the brainstem, the reticular activating formation, RAF, and the pons. And those parts of your brain, they control your subconscious response to pain. So your blood pressure, heart rate, all those things are going to be affected by pain. So if I can reduce the amount of pain that this patient is perceiving on a subconscious level, then I can reduce the hemodynamic effects of the surgery. And that's why we use the local. Again, I'm feeling for my bone with the tip of my probe. You must feel for bone. If you don't feel bone, you can't do the burn. If you don't feel the bone at the tip, it's not safe to do your burn. Shot? Shot? And there, that's the perfect spot. And I'm right on the bone. I'm tap dancing on it with my probe. Shot? Almost done. About 2 minutes and we'll be done. Then we're going to end this live stream and we're going to flip this patient over and do his DLDR, cervical, 2 levels. He's actually coming back for a lumbar on Thursday. We're doing his lumbar and his cervical. All right, did you have a question for me?
Oh, we just got a question from Teak on YouTube.
Hi, Teak.
They asked, just curious, is this covered by most insurances, or do they give patients the run around like they do at times with the DLDR?
Oh, no, this is not covered yet. And the difference is this is so new, we don't have data, like outcome data that we've calculated, that we've published yet, but we will eventually. So if the insurance companies wanted to say this is experimental and not cover it, they have a right to. I mean, since we haven't published any data. With the Deuk laser disc repair, on the other hand, it is published, and they really can't say that. They could say it, but they would be wrong to say it. So that's the difference. This is a newer procedure. The Deuk laser disc repair has been around for a long time, and 17 years, and we've published. All right, you can see the tiny little cuts. They're 3 millimeters. The first one we did C5, C6. The second one we did C7 and T1. And we did bilateral. Remember, he's traveled for 24 hours to get here from Australia. He couldn't get the help he needed there. His life was just miserable. He was in pain all the time. He used to be an avid athlete, cycling all the time, doing all kinds of activities. And the pain in his neck has totally incapacitated him. Every time he does something athletic, it ends up hurting for days, and he can't do anything. So pain does that to people. It creates anxiety. It creates phobia, fear of being active, doing things that are going to bring on the pain. And he's tired of being afraid and living his life in fear and being inactive. So he traveled all the way here for this procedure. All right. Any other questions?
No current questions.
We're going to end this cervical bilateral Deuk plasma rhizotomy. And Henry, we make sure it goes onto the cervical DPR video playlist.
Not a problem.
Awesome. Thanks so much. We'll be back to do his anterior cervical DLDR shortly.